I think that sometimes the language kind of gets in the way of seeing the potential opportunity that's in front of us, and it's really not a replacement. We see examples of where you can use AI as a replacement in other industries, but I think really where we see the greatest opportunity is to become humans who use AI to do their work better or smarter, and to use it in ways that benefits us as organizations, as service providers, and in ways that benefit our communities and our patients.
Yeah, I like the idea of thinking of this as a way to help clinicians do their jobs faster, better, easier, and to get junk off their desk. None of us got into this business to write better notes. We got into this business to help people, and the notes is a kind of an unfortunate byproduct. So if anything we can do to expedite that, I think is really directionally correct for us.
Had the same kind of concerns and discussions, 25, 30 years ago when treatment guidelines and treatment algorithms and care pathways came into vogue. We were worried that people would use them unthinkingly. Probably some did, but we can still improve care, even if some people still do bad care. In general, care will be much better.
Yep.
I think we'll learn to put judgment to it just like we did with care pathways.